I'm a former New York State Supreme Court Justice. Let me tell you about a real case story. It involves something that went really wrong in a post-op situation in a hospital. We'll call her Jane. Jane, as a matter of fact, was around middle age. She had 3 degrees, very well educated, and had a very good position. But she had a little slight problem with what is known as the mitral valve. Mitral valve, without getting too technical about it, is located on the left side of the heart. Actually, it separates the upper chamber or the atrium from the lower chamber or the ventricle, and it prevents the blood flow from actually going back from the ventricle back into the upper chamber. But I don't want to get too technical about that. In any event, it's a rather routine kind of surgery she's in the hospital for, in the hands of a very fine cardiac surgeon. He performs the surgery. Surgery is an absolute success. She's in the hospital bed recovering from the surgery. Now, as a consequence of the surgery, there's a certain amount of blood that flows out that goes into a space known as the pericardium, or the sac around the heart. And actually, this blood should be removed, and it's usually removed with a drain. And a drain is put in, and actually, following the removal of the blood with the drain, everything should be all right. Well, she goes to sleep. Sometime in the early morning hours, one of the young residents of the hospital comes in to check upon the drain. Sees that the drain is no longer draining any blood, and he comes to the conclusion that there's no longer any blood in that pericardium or in that sac that is around the heart, and he removes the drain and he leaves. About an hour or so later, a nurse comes in, and Jane is unconscious. Immediately the crash cart is called, code blue is called, nurses come rushing in, doctors come rushing in. They start with all kinds of shock treatment and CPR, trying to revive her, when suddenly one of the doctors says, "1 minute, give me that needle." And he takes the needle, puts it into the pericardium, and starts evacuating blood. And as blood is being evacuated, suddenly the heart starts beating, because the heart had come to an absolute stop. What happened was that the pericardium itself filled up with blood, and it acted like a straitjacket, like duct tape around the heart. So the heart had absolutely no way to actually beat. It could not move. It was in this straitjacket. And as soon as this blood was removed, then it released the pressure against the heart, and the heart started to beat again. A condition that is called in medical science known as a cardiac tamponade. Okay, I don't want to get, once again, too technical about it. But during the period of time that the heart was not beating, then of course there's no oxygen going to the brain. And as a consequence, Jane developed very significant brain damage. We brought the action. After a 2 or 3 week trial, all of the proof went out, and finally the defense came to their senses, the hospital came to their senses. They recognized that the post-op care was not correct, was not appropriate, and what was found was that the drain that was removed was actually clogged, so that when this resident saw that there was no longer any blood coming out, he assumed that all the blood was out of the pericardium, when in fact it had been blocked by reason of this blocked drain. So we established through those facts that the resident really made a terrible mistake, which of course was chargeable to the hospital. When all of this came out, ultimately, the case was settled for a very significant amount. But poor Jane suffered permanent brain damage. And it will show that even a very successful surgical operation, as this was, if post-operative care is not within the standard of care, then that could be terribly damaging and can even take the life of the patient. That's the story, and that's the end of it. And until we meet again, this is the storyteller telling you to stay safe and please keep out of danger.